Good morning. So we've known that addiction is an equal opportunity disease. As we like to say, it affects everybody of all sort of different stratas in society and different nations and different ethnic groups. And that's certainly true now of men versus women. So gender equality has hit addiction. Back in the day, there was an ad for Virginia Slims, I think, or something that said, "You've come a long way, baby," because it was playing on women's liberation back in the 60s and 70s, saying that, women, you've got jobs now, you're out of the house, you're not just housewives anymore, so you can smoke with the best of them. And that campaign worked incredibly well, so now there's a lot more women smokers and women dying of cancer. In the world of addiction, it used to be 5-1 because women really just didn't get out there and drink like the men did, and they certainly didn't use drugs in anything like the same amounts, but now it's 50-50. So things have really changed dramatically, and we're seeing that in huge numbers of men and women who are getting liver disease, cirrhosis of the liver, needing liver transplants in their 40s and 50s. Even earlier sometimes. And in our practice, we see it's probably very close to 50-50 with people using heroin or street drugs and with alcohol. And of course, what does it mean? It means that this is a genetic illness that some people are born with a vulnerability of their brain, and when they get exposed to drugs that give you a dopamine surge in the brain, that people like it. Some people really value it a lot more than others if they've got that genetic predisposition, and that affects men and women. So we've got to pay attention. We've all got to be noticing how much we drink and what drugs we use and how much, and we've got to be able to offer help for people who have the disease so that they can get into recovery as quickly as possible, and they can stay in long-term recovery, and we as a society can support the concept that that people don't have to drink and party in order to have fun and have a happy life. So it's an equal opportunity disease all over the map, and we all need to be paying attention. Thanks.